y'all see it all right?
Yes, your time starts now.
Hi, we are Team 11, and we wanted to bring to light about a common issue many patients face during physical therapy or PT. In order to do so, we interviewed physical therapy patients as well as physical therapists to learn about the challenges they encounter.
When I hurt my shoulder earlier this year, it took me a very long time to get an appointment with the therapist. And once I got the appointment, it was just really hard to keep up with my schedule and busy life, being as a mom and a working professional.
And let's just not hear from patients, let's hear from physical therapists too.
Most people need a good amount of guidance for what they should be doing, and I can't expect them to do an exercise or something at home unless I directly tell them to. Most people need.
We conducted a survey and concluded that the main reasons individuals did not continue PT were cost, lack of insurance coverage, limited time, traveling often, and forgetting exercises.
And that's precisely what we aim to solve with our app, KineX AI. We want to connect physical therapy with AI to your busy lives.
These are our team members. We have Netra Ramesh, Zinya Haroon, Annika Sachdeva, and Aaron Brunson.
And we'd also like to give a huge thank you to our mentor, Abhi, for assisting us with the program, as well as program coordinators, Jeff, Dr. Tanya, Erica, Tiffany, Ashleen, and the judges here today. According to the World Health Organization, 85% of people in the world lead a sedentary lifestyle, ranging from teens to adults, making it one of the more serious yet insufficiently addressed public health issues of our time. A Florida State University study links physical inactivity to 62% of diseases and chronic pain overall. To combat this, we want to encourage consistent physical therapy to improve mobility and reduce health risks using KineX AI.
KineX is unique due to its combination of computer vision, wearable tech, social engagement, and AI-based analysis.
So these are some of our AI features. The main AI component is pose estimation, which allows the app to correct user position in real time based on angles and flexibility, just like a physical therapist would. We are additionally using an LLM-based recommendation system pre-trained with PT info to provide exercises for certain areas of pain based on user query. Another component is the wearable tech device model based on multimodal data that detects if the user is completing the exercises correctly.
And let's have a walkthrough demo of our app. So here, first, it's going to welcome the users to the app and talk about the different privacy concerns that the user should be aware of. And it's going to take you to the login screen. So here, I'm going to log in with my email address and my password. And if I didn't have a pre-created account, I could create one here with my full name, email address, and password. So now I'm going to click the sign up button. It's going to take me to the home screen, which has a bunch of different features that I'm going to go through in just a second. So I'm going to click the camera icon on the bottom, and it's going to have real-time pose estimation. Alternatively, you could also upload a file to do pose estimation on, and then I'm going to click OK. And AI is going to analyze your session with timestamps on how you can improve and what you did well. So going back to the home screen here, I'm going to click the Send PT Report button, where you can send your doctor different statistics about your last session so they can keep up with what you're doing at home. I'm going to click the Ask for Exercises button, where you can chat with our AI LLM called Patty the PT Aide, which can give recommendations for exercises that you should do at home. I'm going to click the Your Progress button here, and it has different items that need to be completed and what you've already done and how many reps that you've done. I'm going to click the leaderboard button. So we have a leaderboard here for social network engagement between other PT patients like Duolingo. Here you can click on a user's profile to connect with them virtually like Maria here and encourage each other to keep up with their PT regimen. And now I'm going to click the past sessions button, and you can look at the analytics of all your past sessions. And then you can delete if you don't want to hold on to it anymore. And I'm going to click the target treatment, and I'm going to press quads, and I'll give you exercise examples what you should do if you want to target quads. And now coming back to the home screen, it has a bunch of charts to show how you've been doing over time. And then on the left here, you can see the libraries that we used when developing our code.
During our research, we tried to find other physical therapy apps similar to IDEA, and we found 4. PT Timer and Hinge Health for physical therapy homework, Prehab with its real-time feedback, and Exer Health, which utilizes multimodal quantification and real-time feedback as well. KineX, however, stands out by integrating these wearable devices into the AI-based system, involves accountability, allows for social networking, and encourages a competitive yet uplifting environment to aid others through their PT journey in connection together. As the market in AI healthcare has been gradually increasing, we realize the necessity of our app. However, as of now, physical inactivity accounts for $24 billion a year in health expenses. To combat that, we're providing a low-cost subscription model to reduce medical fees for our families.
So next, we're going to move on to the ethical AI matrix. We really wanted to emphasize that KineX is ensuring consistent care with HIPAA protocols in place, transparent data access, and we also have privacy regulations installed, including public versus private profiles with an option to delete session data. Bias is mitigated by using our diverse set of data for the training of the models, including a variety of ethnic backgrounds, age levels, flexibility, and experiences in PT. KineX is empowering patients to control their physical therapy schedule and is also allowing for more accessibility by easing medical bills and fees for families with our low-cost subscription model.
For our next steps, we look forward to combining AR-guided exercises with pain tracking to enhance physical therapy and personalized care. It also offers real-time biomechanical analysis and personalized engagement. KineX aims to expand impact through global partnerships, delivering therapy to underprivileged areas through a low-cost model, and adapts features using continuous learning algorithms based on feedback and research.
And something really important to note is that we conducted 2 interviews of physical therapists in Maryland and Florida, and both of them that we interviewed said they asked for us to implement this tool in their clinic once it was ready for launch.
These are our works cited. And thank you so much all for listening, and we will be happy to answer any questions.
Thank you. This is an amazing presentation. I had one question. You mentioned you're going to combine this with wearables. Can you specify what kind of wearables you were mentioning?
Great question. So as of now, here's some of the code that we had. So wearable tech data, it could be just like an Apple Watch, but in the future we plan to implement smartphones. So we use this data from the UC Irvine machine learning repository and then conducted signal processing and just like different types of data to eventually find out which vibrations work. And like along with the pose estimation feature, we wanted this to aid the computer vision so it could offer real-time feedback. So ranging from Apple Watches to eventually smartphones, this is what we plan to implement.
Thank you.
Okay, I'll go next. I really loved the problem and your solutions to it. I think this is really leveraging AI into get data that is not really visible to users. So really love the direction you chose. I wanted to ask you, how do you plan on taking the will of a user to meet the physical therapy in person, right? I mean, we all want our doctors to look at us, right, physically, and get this meaningful interaction that we're already so used to. So what's your plan on explaining users this kind of new method of seeing physical therapy?
Absolutely. So we wanted to emphasize that we're not directly replacing physical therapy, but we will be using this as a tool to aid physical therapists to collect more data to get a more structured idea of what the patient's future path should be. And additionally, we wanted to target people who don't have as much time to go in person for PT, but still want to be conducting their regimens at home consistently. And additionally, people who are lower income.
Great. That's great answer. I'll follow up with another question about it. Did you consider using it in a physical therapy session, live session?
Yes, so
it helped in real time.
Absolutely, yes. So some of the code that we created actually does take real-time data and it converts it into GIFs. And additionally, since we had talked to a couple of physical therapists, that would be our next step, is to actually test with real patients in person. So yeah.
Thank you. Great job.
Judges, do you have any additional questions? We have about 2 minutes.
I can go. Really, really good app. I think everyone in the chat is saying I agree. I would use it myself. Any thought about expanding your target audience to gyms or just personal people working out by themselves that want to protect their form a little bit?
Yeah, so absolutely. I think right now we really wanted to focus on the medical application of our app, but we had initially thought about applying it to like gym form. Like I know a lot of people like to do weightlifting, but don't necessarily know if they're doing it correctly. But that would be definitely like a far future step kind of idea. As soon as we can get this physical therapy part, this target kind of achieved, then perhaps if we want to make an extension of the app line for sure.
Brilliant. Thank you.
Thank you so much.
Thank you.
Yeah. One last question for me. I think one of the hard parts about doing physical therapy, you guys outlined a bunch of really good ones, but one of the other ones is just the motivation and like reminders. Have you guys thought about sort of like how you can, like what kind of reminder systems you can build in and encouragement you can build in for people to be able to engage more with your application and with the therapy that they need to do?
Yes.
Right. Oh, sorry. Go ahead, Senia.
I can take this question. So a really big aspect that we took into consideration is our leaderboard. I don't know if you've used the app Duolingo, but you know how their whole mascot is like, oh, we want to encourage you guys to use the app to keep up with your lessons. They'll have push notifications on social media platforms. They have this really big like icon saying like, oh, if you don't do your lessons, like something bad will happen to you. Like kind of building that reputation, but the leaderboard and kind of turning it into that like friendly competitive version of this app really encourages users to come back and stick to their regimen. And then you can only come up on the leader by sticking to your regimen and using the app.
I like that. That's great. Thank you.